A very good morning, dear viewers on YouTube, Facebook. This is Mohammed Khalaf, and I would warmly welcome you all to this interesting webinar we have today. Firstly, I would like to say that it is indeed a matter of great honor and pleasure for us to be collaborating with Hearts and Minds. I would like to thank Hearts and Minds for providing us with the platform and also for the enormous support that we've received throughout the past few days. And we are looking forward to collaborating with you in the future. So the topic of our webinar today is actually in the form of two questions. Is my brushing technique correct, or how do I maintain oral hygiene with braces? Now these are questions that we as dentists Okay, I apologize for the slight technical difficulty. Um, a very good morning, dear viewers on Facebook, YouTube. This is Mohammed Khalaf, and I would warmly like to welcome you all to this interesting webinar that we have today. Firstly, I would like to say that it is indeed a matter of pleasure and honor for us to be collaborating with Hearts and Minds. I would like to thank Hearts and Minds for providing us with the platform and for the enormous support they have provided us with for the past few days. The topic of our webinar is actually in the form of two questions. The first, is my brushing technique correct? And second, how do I maintain oral hygiene with braces? Now, these are questions that we as dental students, we as clinicians come across on a regular basis. So, this is again a very important topic, as I feel that this is something that is kind of overlooked at. So, we as a year 4 dental students, we would like to share our knowledge, our expertise on this so that you can greatly benefit from this. So in this webinar, we aim to cover a wide array of topics, right from gum disease to what scaling is to look, and then we'll be looking into different brushing techniques. So the speakers for today are myself, that is Mohammed Khalaf Ahmed, Lo Shushwen, Nandini Gunasekaran, Jing Shen, Mohammed Zaid. And our facilitators are Dr. Bennett and Dr. Priyank. So these are our committee members who have been working tirelessly and diligently in making this webinar a success. So as you can see, these are the contents of the webinar. So we will look into a wide array of topics, from what is gum disease to plaque and calculus to who are at risk for gum disease. We will look into what scaling is, the importance of periodic scaling, and then we will look into the different oral hygiene aids. After the webinar is done, we will have a question and answer session followed by a very interesting session of quiz, and we have an exciting announcement to make at the end of this webinar. So I would also like to say that this webinar is being conducted in conjunction with Gum Health Day 2023. So Gum Health Day actually falls on the 12th of May, and the theme for the Gum Health Day is Healthy Gums Look Good on You, Protect Them, which is what this webinar is all about. So this is actually an initiative started by the European Federation of Periodontology. Okay, moving on. So, what is Gum Health Day? So, Gum Health Day is an international awareness day held every year on the 12th of May. Its aim is to increase public awareness of the importance of taking care of the gums, maintaining good oral hygiene, and visiting the dentist for prevention and treatment. Okay, so before we dive into the topic, so I would like to give a simple introduction as to what the situation of gum disease is. So, as you know, gum disease is a very common condition and it's highly prevalent among the Malaysian population. According to a survey that was done in 2010 by the National Oral Health Survey, 9 out of 10 Malaysians suffer from gum disease. And despite the prevalence of the gum disease, there is very poor awareness pertaining to the oral health among the general population. And then studies also have shown that there is a strong correlation between gum diseases and other systemic conditions such as diabetes, heart disease, etc. So the most interesting thing about this is something that is very preventable. So by visiting the dentist regularly, by having early detection and treatment, gum diseases can be prevented, and this will it will help reduce the prevalence of gum disease. So hopefully we try to educate all of you in this webinar about the importance of maintaining your oral health and especially your gums. With this, I would like to pass to the next speakers, Shushwan and Nandini.
Hi everyone, my name is Shushan. So let's start off with our webinar with gum disease. So what is gum disease? Sometimes we might find our gums very swollen, reddish, and bleeding may even occur when we are brushing. This is actually because of our gums are having inflammation, which is known as gingivitis. But how? Why are we experiencing this? It usually happens in individuals with poor oral hygiene, as the biofilm will form easily on the surface of our teeth. Also, the amount of bacteria contained inside the biofilm is over 700 species, making our gums very inflamed. Besides, for those who are smoking, not only smoking, it also includes those who are vaping and shisha. Pregnant lady or those who have certain kind of medical disease are more prone to have gum inflammation. Pregnant lady is also one of the risk factors. This is because of the hormonal changes during the pregnancy. Some people might think gum inflammation is nothing, thinking that it is just for a short period of time, nothing serious is that. But then it actually could cause serious complications such as tooth loss and periodontal disease. So now let's look at the difference between the healthy gums and inflamed gums. And as you can see in the picture on the lower left, the healthy gums are pink color and firm in consistency, whereas the inflamed gums are dark red in color and very swollen. Bleeding during brushing is quite common. What causes the inflammation? As what we discussed before, inflammation is caused by the biofilm formation. As you can see here, there are the content of biofilm. Biofilm is also known as the plaque, which is soft, sticky, and white in color. It is made up of different kinds of bacteria that can be removed with brushing and flossing. Whereas calculus on the right is the hard deposit that cannot be removed with brushing. For the removal of the calculus or tartar, we need to go and visit a dentist to have scaling. Have you ever wondered who are at high risk for gum disease? Firstly, we have those with poor oral hygiene, as the plaque we mentioned earlier is built up and infecting the gum tissues. Secondly, smokers, shisha, and vaping. Smokers usually have affected host response, which is more susceptible to infection and diseases. Also, nicotine content in cigarettes causes periodontal tissue breakdown. The next one is the individual with teeth grinding and clenching habits. This is because there's a lot of strain on teeth, causing them to become loose, and the pockets are then created between the root surface and the gum tissue. And then, bacteria will be trapped inside these pockets, Moving on to the next slide, elderly. Elderly is also more prone to have gum disease due to the weakened ability to fight against the infection. Even though treatments are provided for them, it is also very difficult for the gum tissues to heal. Up next is the stress. All of us have stress, but stress is not good for our health at all as it is linked to many health conditions, making our body difficult to fight against infection and reducing the salivary flow at the same time. Medications such as oral contraceptives and antidepressants will be causing dry mouth problem due to reduced salivary flow, compromising the self-cleansing effect of saliva as it is difficult to wash away food debris from the teeth. Also, saliva contains antibodies that help to fight against the bacteria. For the seventh point, for those who are poorly nourished, it is quite difficult for them to fight off the viruses and diseases because of their weakened immune system. Meanwhile, having excess of sugar in diet is also not a good sign as the tooth surface enamel is weakened, making it very easy to collect bacterial plaque or biofilm. Then, diabetic patients are those with high blood sugar level. They will be having high concentrations of inflammatory mediators, causing them more susceptible to infections. This is actually a two-way relationship between diabetes and gum disease, as long-term gum disease will result in exacerbation of inflammatory response, leading to poor glycemic control. To get rid of gum disease, we can have scaling. So now let me explain to you what is scaling. Scaling is the treatment that causes our teeth to be thinner or shaky. No, the fact is our teeth is made up of hydroxyapatite crystals, which is a harder substance in our body. It is even harder than our bone. The scaling is the removal of plaque and calculus from the tooth surface and below the gum line. After that, polishing is also performed after scaling to smoothen the tooth surface to decrease harboring of bacteria after the scaling. Let me introduce you one more thing, the root planning. As you can see in the picture, root planning is actually similar to scaling. The only difference is the special instruments is used to do deep cleaning of tooth surface below the gums level. As you can see in the picture, the instrument is inserted into the pocket to remove the calculus. Coming up next is the table showing the difference between hand scaling and ultrasonic scaling. To perform hand scaling, we use a set of instruments to remove the calculus and plaques above the gum line manually, with the correct adaptation and angulation using powerful pull stroke. Whereas for ultrasonic scaling, only one handpiece is used to vibrate and remove the tatas. You might be wondering if ultrasonic scaling or hand scaling is better. It actually depends on the situation. For example, during COVID time, hand scaling is more preferred as it has no aerosols during the procedure, unlike the ultrasonic scaling. Also, for those who have dentinal hypersensitivity, it's better to go for hand scaling as ultrasonic scaling has water coming out, which might make the patient more sensitive. Thank you. I'll pass it on to Nandini to explain the importance of scaling.
All right. Hello, everyone, and a very good morning. My name is Nandini, and today I will be telling you why is scaling very important. So, as we all know by now, scaling is the removal of plaque and calculus from the tooth surface. By doing so, it prevents gum diseases such as gingivitis and periodontitis. So, gingivitis is the inflammation of the gums. It starts when plaque containing millions and millions of bacteria is hardened to form calculus over time. So the bacteria in the calculus then will irritate the gums, causing it to bleed and causing it to swell and bleed easily. And that is why the first sign of gingivitis is always bleeding of the gums when you brush your teeth. Okay, so periodontitis is when the infection spreads into the deeper layers of the gums around the teeth and also inside the bones. The progression of periodontitis will eventually cause tooth loss, because the support from the bone is compromised. So next is the prevention of halitosis. So what is halitosis? Halitosis is actually bad breath. The primary cause of halitosis is because of coated tongue. So coated tongue means the tongue is basically covered in bacteria, and this is because the tongue consists of very minute structures that help in the breakdown of food. However, gum diseases such as gingivitis and even periodontitis that is caused because of plaque and calculus accumulation can also cause bad breath. Other causes include tonsil stones, dry mouth, and even dental caries. So speaking of dental caries, the next importance is the prevention of dental caries. Dental caries basically means those cavities or the holes that form on the tooth surface. The main bacteria causing dental caries is Streptococcus mutans. It starts when the bacteria from the calculus releases acids that will remove minerals on the enamel. As we all know, enamel is the outer layer of the surface. With the removal of minerals, it will cause tiny holes to form. So the acid will then reach the second layer of the tooth, which is known as the dentine. The exposure of the dentine is what gives us the hypersensitivity reaction when we eat or we drink cold items, or even when the dentist blows air onto the tooth surface. So if no action is taken to stop the caries progression in the dentine, the infection is going to spread into the pulp. Okay, so the pulp is the innermost layer of the tooth. It consists of nerves and blood vessels. So when the bacteria goes inside the pulp is going to get infected. So it means that the pulp is going to become inflamed, and the tooth will have to undergo a root canal treatment. So what are the risk factors associated with this? It includes inadequate brushing. Inadequate brushing means you don't brush your teeth correctly. You don't brush your teeth enough, especially at night before you sleep. Other than that, frequent ingestion of sugary food. As we all know, sugary food is very detrimental to the oral health, and also eating foods that cling onto the teeth, such as cookies, chips, and even candy. Okay, next, I will tell you about the effects of calculus onto the overall health. So the main risk factor here is dental bacteria, as because plaque and calculus, it is consists of microcolonies of bacteria. I'm talking about millions of bacteria. So they can damage the arteries around the head and the neck region, causing blockage of the blood vessels, leading to fatal diseases such as stroke. Other than that, they can also go and infect the heart and cause plaque buildup in the arteries, which will cause the blockage of blood flow, leading to a heart attack. The bacteria from the calculus can also move from the mouth to the lungs, irritating our respiratory system and giving rise to infections such as bronchitis and even pneumonia. And in pregnant women, it can cause low birth weight, preterm birth, and even stillbirth. The recommended dental treatment for pregnant women is only in the second trimester, as in the first trimester, the baby's vital organs are forming. And lastly, the bacteria can also make its way to our brain, destroying the brain cells that will lead to the progression and the development of Alzheimer's. So in this mind map, it shows the various diseases that are associated with periodontitis, which is gum infections. So now we know that calculus doesn't only cause harm to the mouth and the teeth, but it can also go and damage a lot of the other parts of the body. Okay, so now let me tell you a few diseases that can show their signs and symptoms in the mouth. So first off, we have diabetes. Diabetes reduces the salivary production in the mouth, which makes the patient more prone to dry mouth and dental caries. There's also more glucose in the saliva, which will cause more plaque and calculus buildup. Other than that, it can alter our body's natural defense mechanism that will cause the reduced wound healing. Infectious diseases such as tuberculosis or even herpes simplex virus infections can cause ulcers in the mouth to form, especially in the tongue or even the palate region. And sometimes these ulcers can be very painful. And lastly, autoimmune diseases such as Sjogren's syndrome can affect the tear and also the salivary glands, decreasing the salivary flow. And this will also lead to dry mouth and increased dental caries. So that is all for my part. And now I will pass the presentation on to Jingxuan. Thank you very much.
All right. Thank you, Nandini. My name is Jingshen, and today I'll be discussing periodic scaling as well as the methods of brushing. And I'll have my friend, my colleague, Muhammad Zaid, who'll be discussing alternative oral hygiene aids. Okay, now coming to periodic scaling, when should you come in for scaling? Well, the answer is for the general population is that you have to come in for every 6 months. But for patients who smoke, have diabetes, or even have severe gum disease, you would have to come in every 3 months for scaling and polishing. Now you may be thinking, what are the benefits? What do I get from this? Well, firstly, you get to maintain your oral hygiene, and we will get to reinforce the oral hygiene instructions upon you if you are, let's say, doing your brushing techniques wrongly. Second, we can detect new dental caries and prevent them. 3, we can detect any oral pathologies, in particular, early signs of oral cancer. Well, maybe these signs or symptoms of oral cancer may include lumps around the head or neck, have red or white patches in your oral cavity. Maybe you may be feeling numbness. So if you are having any of these symptoms, please visit your dentist as soon as possible. Now, coming to the OHI aids, they usually include toothbrushes, interdental brushes, floss, and mouth rinse. Now, before I start teaching you about the various ways of brushing, let me give you some brushing tips. Well, firstly, we'll be using a soft bristled toothbrush because the hard bristled toothbrush actually damages your gums. 2, we have to brush twice a day. 3, with a fluoridated toothpaste. And 4, we have to brush 2 to 4 minutes. Whereas actually the method and the technique of brushing is more important than the duration of brushing. And according to the Ministry of Health, the fluoride concentration for children ages below 6 and below 3 is 600 parts per million, as you can see from the picture above on the right. And for children below 3 years, you have to use a smear amount of toothpaste. And for 3 to 6, you'll be having to use a pea-sized amount of toothpaste. And for children 7 above, including adults, you would have to use a fluoridated toothpaste consisting of 1,000 parts per million fluoride and above, with the amount of toothpaste being the whole length of the bristles. Now, here's a fun fact. Did you know how much time we spend for brushing? Well, according to the Academy of General Dentistry, each person spends about 45 to 70 seconds every time brushing their teeth, which equates to about 38 days of brushing throughout your entire lifetime. Imagine all those time being in the toilet just brushing your teeth. All right, now coming to the brushing techniques. What I would like to demonstrate first is the modified best method. Well, this method is the best for the general population. So how do we go about it? Well, firstly, I'd like to show you. I'm very sorry for the background. Okay, I'm very sorry for the background. First, we have to engage the brush 45 degrees towards the gums and towards the teeth, and brush in a front and back motion. Well, we should brush in a front and back motion. Same for the lower teeth, where we angulate the brushes 45 degrees towards the gums and towards the teeth, and brush in a front and back motion. It goes for the same for the front teeth, and for the biting surfaces, you would like to brush in a front and back manner. Now for the inside portion of the front teeth, regardless of upper or lower teeth, we will have to brush on a up and down manner. Same thing for the upper teeth, where you are facing the brush down and you have to just brush front and back. So, and I'd like to focus that when you're brushing, the back teeth, front and back, you have to swipe towards the biting surface. This is in order to remove the tartar, or no, sorry, not tartar, the plaque which is present in between your teeth. Now, coming to the next method is the phones method. Well, this is not the best, but it is indicated for children who are just developing manual dexterity, which is highly effective for them to maintain oral hygiene. Well, how do you do this? First, you put your brush onto the teeth itself, and you just have to teach the children to brush in a circular manner. Well, it is irrespective of which quadrant or which part of the teeth you're brushing. You just have to brush in a circular, gentle circular manner. But for the biting surfaces, you would still have to go in a front or back manner. Okay, here's another fun fact before we continue with the last brushing technique, is that braces are actually 300 years old. Well, these braces are actually 300 years old, and they were first invented by a French physician called Pierre Fauchard. And the type of wire that we always see in braces nowadays is actually invented by NASA, and they are still being used to this date. Now, for patients with braces, how do you take care of them? Well, there's a special type of brush called a orthodontic brush, which you can purchase in your local pharmacy. It is different from the usual toothbrush that we use in the sense that they actually have a depression in the middle, which facilitates the brushing of your teeth. Well, I would like to simulate if you have braces. Sorry for my background. Let's say if you have braces, you have to brush on top of the brush facing down on top of the braces, and brushing in a front and circular manner. And when you're brushing the underside of the brackets, you'll be brushing in a circular manner as well. For the chewing surfaces, it goes same as usual, front and back motion. And for the upper and lower inside surface of your teeth, you'll be brushing in a front and back manner, front or up and down manner. So that's all for my part. My colleague Zaid will be continuing the presentation. Thank you.
Very warm good morning to everyone. Thank you, Jinshan. So we all know that brushing is really important. It keeps us awake, keeps our gums healthy. But apart from brushing, we also have other oral hygiene aids. So we have something called interdental brush. So what is an interdental brush? Interdental brush is mostly indicated for patients who have larger gaps between the teeth, larger spaces between the teeth. And it's also indicated for patients who have got braces and bridges, helps the cleaning debris way better. So what is an interdental brush? Interdental brush has small bristle heads. And let me actually show you. So it's got small bristle heads here. It helps to clean the interdental spaces between the teeth, the two gaps here, as you can see. Sorry for the video. So you just do it once in and out, in and out. But moving on, I would like to, so as you can see, this is for the front teeth and on the left-hand side, and that's for the posterior teeth. But before showing you a demonstration of how to use an interdental brush, I would like to mention a few tips. How to know that this is a correct size of your interdental brush. So the first thing to do is that you should take the smallest size of the interdental brush, and you should try to put it in, slide it in. And once that also doesn't fit in, if it's still way too big, then the best thing to use is a floss. A floss is indicated for you. Now here you must be wondering that why is the interdental brush here angulated? It's making more of an L, and the other ones are straight. So the angulated interdental brush is mostly indicated for posterior region, for the back teeth. That's why it has an angulation, makes it easy. Now the other ones, the ones which are straight, are indicated for the front teeth. That's why they are straight, makes it easy. And as you can see here, these are the different sizes on the right-hand side, different sizes of interdental brush that you can use. Now, next will be a short video of a demonstration of how to use interdental brush. As you guys can see, yes. So that is for the posterior region, how it is inserted, slides in, once, in and out, in and out. In and out. So that's all for the interdental brush. Now moving on with the dental floss. So flossing helps with a lot of, it's got a lot of benefits as well. Flossing actually reaches areas where a toothbrush cannot access. And also interdental brush, because flossing is only indicated for patients who have very small gaps where an interdental brush cannot go in, cannot fit in. Only then flossing is indicated. So moving on, I'll speak on the different types of dental floss. So we've got regular floss, which we almost everyone know it by now. Then we've got floss picks and ergonomic floss. Moving on. So this is a short video of how to use floss. So I've got a regular floss here with me. So using a floss, you need to use 18 to 24 inches. I got 18 to 24 inches here with me. I'm gonna wrap it around my fingers and use my middle finger and my thumb. So here on this video, there will be a better demonstration of how to use a floss. As you can see, the spaces are very narrow. He's making like a C shape when he inserts it in. So see, he has to first clean one side of the surface, then he has to switch to the other side. Okay, that's all from the video. Thank you very much. So floss versus interdental brush, what do you guys think? What is better? You can let us know in the comments. But as for me, what I would like to say is that interdental brush is better than a floss. So it actually tends to remove almost all the remnants, and especially indicated for posterior teeth. Compared to floss, floss tends to leave a lot of remnants, and this will be demonstrated in a video. As you guys can see here, there's a lot of remnants left. But an interdental brush cleans almost everything. Okay, so moving on, this is the mouth rinse that we all are very familiar with. Now, mouth rinse help us in a lot of ways. It helps with the bad breath. It also helps to reduce plaque and gingivitis when combined with daily brushing. And it is also it reaches areas where easily not accessed by a toothbrush. Now, there's different types of mouthwash. There is antiseptic mouthwash, as we all know, chlorhexidine. So chlorhexidine, we have to take 0.12% undiluted 30 minutes after toothbrushing. But if you are taking the normal one, if it's fluoridated mouthwash, or if it's Listerine, you should take 20 mils, also undiluted. And there's also another type of mouthwash is a fluoridated mouthwash, which is used for tooth decay in most cases. And very important, mouthwash is not recommended for children under the age of 6 years. Moving on. I'll pass my presentation to Khalaf. Thank you all.
Okay, in conclusion, I would like to say that gum disease is much more common than you think. However, despite it being so common, there is a very low awareness of the maintenance of oral hygiene and the gums amongst the public. As you know, there are about 57 systemic diseases such as heart disease, diabetes that are associated with gum disease. Hence, we have to say that periodic scaling is a must. So this is something that we have to always make sure that we should make sure that we visit the dentist on a regular basis to get our scaling done. So make sure you follow the right measures to keep your gums safe, and that is obviously by prevention. So you learn the different brushing techniques, you learn how to use different oral hygiene aids such as interdental brush, floss. So I hope you use this in your life to make your gums healthier. So I have a nice and short exciting video for you. This is from the EFP. I hope you enjoy this. Okay, I hope you enjoyed the video. So these are our references. So for those who are interested in further reading, can have a look at these references. There are tons of exciting information that you can learn and apply it in your life. So with this, we open the floor to questions.
Hi guys, do type in your comments or your questions down below. So I see a question from Ong Yi Ching. Okay, she asks, hi, is it true I have to change my brush every 3 months? Yes, actually you should change your brush every 3 months. In fact, there are actually several indications that you should change your brushes. Well, firstly, you should change your brush every three to 4 months. Secondly, you should change your brush when it is splayed, or basically when the brush starts to come very loose. And when you brush, it doesn't feel as clean as it used to. Second is that when you have a disease, or maybe you have the flu. So when you have some disease like the flu, it is recommended to change your brush right after the disease to maintain better oral hygiene. And not just brushes, I would say that toothpaste as well. We should not share toothpaste with your family, and especially if that you are having a cold, you should not share with your family. Yeah. Now I see a question from John Lim as well. Can I do scaling with braces? Actually, you can. In fact, it's more essential that you go to the dentist to get your routine scaling done, because for patients having braces, you are more susceptible to having tartar or plaque buildup, as well as the presence of caries. So do get your scaling done regularly, John.
I can see a question from Bunny Ellie saying that how to choose the correct size for interdental brush. Actually, you can just put the interdental brush in the interdental area. If it's too loose, you need to increase the size until you feel a snug fit. If it is too tight or too big, you might need a smaller size. If the smallest interdental brush isn't going in also, then you can go for a dental floss. Another question from Bunny Ellie also. Ultrasonic scaling or hand scaling is better. It is actually, I wouldn't say which is better. It really depends on the situation. As for COVID, we would do hand scaling instead because hand scaling won't have aerosols like ultrasonic scaling. And then for time wise, sometimes we can say that ultrasonic scaling is faster than hand scaling.
Well, I see a question from Mingju. Do I need to brush each and every time after finishing a meal? Well, the correct answer is not as direct as you think. Well, for brushing after a meal, you should brush at least 30 minutes or 30 to 45 minutes after your meal, because your teeth is actually quite prone or basically easy to have abrasion, which we call tooth wear, if you brush right after your meal because of the acids produced. So if you want to brush beforehand, go ahead, but do brush at least about 30 minutes before starting your meal so that you can let the fluoride to act on your tooth itself.
Okay, another question. When do I need to be worried of my gums? Is it if it bleeds when I brush? Does it mean I'm brushing hard? Okay, so basically, the tooth structure, the outer enamel, it is hard. Like what Shushan has said earlier, it is in fact harder than bone. However, it is still a tooth structure. So if you're going to brush very hard, it's only going to wear them out. That is why we always recommend our patients to use soft bristles toothbrush and just gently. You don't have to clean your teeth based on how hard you brush them. That is why we have taught you the correct techniques of brushing your teeth. The way you angle them, the way you swipe them down, all of those things are going to save them and clean your teeth better, not only because you brush them harder. Another thing is like what I've discussed earlier, if your teeth is starting to bleed when you brush, it might also mean that you have gingivitis. So I hope this cleared your doubt.
Okay, I think I have a question I see here from Lim Gyok Ling. So I think he or she asked, can I mix my mouth rinse with water as it's very, very spicy? Okay, I understand, Lim. So for your mouth rinse, let's say for your usual day Listerine, which is one of the most common mouthwashes, you are not supposed to mix them with water or dilute them. Because if you dilute them, then the effectiveness or the efficiency of it decreases. So please use them, although it may be hard to bear, but please use them undiluted, or you can perhaps opt for a less spicy mouth rinse.
Do you have any more questions?
I've seen a question. It's asking that does brushing causes hypersensitivity? Um, Normal brushing with normal toothbrush and the normal toothpaste will not cause any tooth sensitivity unless you are using those. I have seen a lot of toothpaste which has so-called whitening effect. They are actually having those tiny sand dentrifices that will abrade our enamel. So please use a regular toothpaste like Darlie, Sensodyne, which is containing fluoride, that it will not cause any tooth sensitivity. And use the softest bristles for toothbrush. Thank you.
Well, I think we have another question from Mengju Ong. So, how to choose a correct toothbrush? Well, firstly, like I said, that we have to focus that we are using a soft bristled toothbrush with a smaller head size, so you can move it around your mouth. And then we should have a handle grip that is long. And if you are not if you are very confused, you can just go to your local pharmacy and to go to the toothpaste brushes section, and you have to find the sizes that are suitable for adults or children for that matter. And but do remember that soft bristles is very important. Oh, I think we have another question coming from Tilden. Should I use the mouthwash with or without alcohol? Okay. So there are actually many types of there are many types of mouthwash in the market. So regardless which type of mouthwash you are using, as long as you use it as per the manufacturers or the dentists or pharmacists recommendation, then you're good to go.
I have another question here. If I brush harder, will it clean my teeth better? Answer is no, because if you brush too hard, you will abrade your teeth, and in the long term, maybe 10 years, you will see your teeth is chipped off at the cervical area near the gums. So the important thing is the correct way of brushing technique, as we taught you just now. It's not about the force, it's about the technique. Thank you.
Maybe we'll take one more question.
Okay, I think I see a question from Hania. Hi, are these gum disease toothpaste really effective? Um, well, toothpaste is more for prevention rather for any treatment. So if you feel that you are starting to bleed, or you feel any teeth on any of your teeth starting to be mobile or start to wiggle, it's recommended that you visit the dentist to have your teeth professionally cleaned to prevent any furthermore disease.
I've got another question. How to make my kids brush teeth when they're uncooperative? Maybe you can choose the toothpaste with flavors because like those toothpaste for adults are considered spicy for them because of the mint. So maybe you can choose apple flavor or something like that.
Okay, thank you, Shushan. I think we've taken enough of questions. Okay, so now comes an exciting session. Okay, so we've been talking about scaling, about the importance of scaling, ultrasonic scaling, hand scaling. What if I tell you that you have the chance to get a free scaling treatment done here at our clinic at SEGi University? So for this, we have prepared a quiz, a very simple quiz, which I'm sure many of you can answer. So the way how this quiz works is the top three people who score the highest marks will win this scaling voucher. This scaling voucher will be emailed to you, and then we will provide you with all the details, the terms and conditions, etc. I regret to say that this is only applicable to Malaysians or people residing in Malaysia because our clinic is in Malaysia. However, everyone is free to join. You could just take up this quiz as you wish. Okay, so for this quiz, I have prepared a barcode which you can scan, and then you can start doing the quiz. Here we go. So you can scan it for now. I'll give you 2 to 3 minutes, and once you guys are done scanning, maybe you guys can do the quiz in your own time. Okay, so I really hope you all benefited from this webinar, and you see to that you follow all the instructions that were given. This will not only help you improve your gums, it will also help you improve your smile. So I would like to thank all our viewers today, and then I would like to thank Hearts and Minds, specifically Miss Muller, for providing us with the platform and for the enormous support that she has provided us with. And I would also like to thank our lecturers, especially Dr. Bennett and Dr. Priyank, for guiding us and for making this webinar a success. So thank you so much, and I hope you really have a nice day.